For the first time ever, 4 American companies are growing and studying cannabis for medical research, and one of them is based here in central Pennsylvania. Fox 43's Harry Lee explains the history of cannabis research and why it's never been allowed before.
For the last 60 years, this field in Mississippi has been the only federally legal source of cannabis. Why has this plant, now legal in 37 states, been off limits to medical researchers? It goes back to the 1910s, when cannabis began to be vilified as the more foreign-sounding marijuana. The drug was banned in 1937.
There's been a transition through the Prohibition period that has put a lid on access to cannabis for drug development through the traditional routes of clinical research.
Research in the U.S. picked back up in 1965 at the University of Mississippi with one man.
Would you say you're the father of cannabis research?
I am maybe the son of the son or the cousin or something, but not the father of.
Mahmoud El-Soli faced decades of skepticism from the academic and medical communities.
Even to the late 80s or early 90s, just the use of the word cannabis or trying to develop a product from cannabis, people shy away from that.
But as attitudes towards cannabis changed, interest grew in studying the plant's potential. But that research wasn't allowed.
The pharmaceutical companies had to be very careful about handling of cannabis, since it was and continues to be federally illegal.
So in the U.S., there's been no research, animal trials, or clinical trials that could lead to new drugs, even as tens of millions of Americans gained access to legal medical or recreational cannabis.
It's been far too long that the biotech, the pharma, the academic industries have sat on the sidelines and watched a massive experiment unfold on behalf of consumers in the United States, but they haven't been able to participate.
Because cannabis remains federally illegal, studies on its health effects are few, including whether it's safe to smoke or vape.
We just don't have that much research on the effect of vaping cannabis. But facilities like this, one of only 5 in the country federally approved to study cannabis for research, is helping change that.
Steve Groff, who owns one of those companies, wants to add to the research.
It's still in its infancy as far as understanding the complexity of the plant.
The cannabis El-Soli produces has mainly been studied in cigarette form, so it usually doesn't pass 6% THC. Groff's cannabis reaches THC levels of 30%, so researchers can study that chemical specifically, or any combination of the plant's more than 100 compounds.
CBD, THC, CBG, CBN, all the cannabinoids, as well as terpenes, flavonoids, etc.
El-Soli says he's ready to share his 6-decade monopoly on federally legal cannabis production.
Another barrier is cost, nearly $1 billion on average to bring a drug from research to market. With such a huge potential market, though, cannabis drug research will likely find funding. Harry Lee, Fox 43 News.